Hey, good afternoon, Mr. D.
How you doing?
My name is Delilah Stinson. I am a nursing student at the University of South Alabama in Mobile. Is it okay that I perform my respiratory checkoff with you?
Yes.
Okay. You do give consent?
I do consent.
Miss Akila, will you scan the room, please? Is it okay that I use my hands? Do you need me to put on gloves?
No, man.
Okay. I'm gonna take off your gown. Okay, so we can see the top half of your chest. Okay. So, what I need to tell you is about the cardiovascular system. I'm going to tell you the location of the apical pulse, and it's on the left side of your chest, the mid-clavicular line on the fifth intercostal space. I also want to tell you about the apex is also located there as well. Fifth intercostal space, mid-left clavicular line, the base, third intercostal space, on the left side of the sternum. Okay, I'm assessing your chest, looking for lifts and heaves. I don't see any of that at this time. Your heart rate should be between 60 and 100. Okay, and we also take note if it is regular or irregular. Okay, so moving forward, I also want to talk to you. I want to palpate it. I want to see if I can feel it. I should not be able to feel your heart beating out of your chest, okay? Your apical pulse. Okay, so I also want to talk to you about the aortic, which will be on the right side of the sternum, the second intercostal space, pulmonomic on the left side of the sternum, second intercostal space, the base of the heart, third intercostal space, tricuspid, fourth intercostal space, and the apex, which is located where the apical pulse is the apex part of the heart, fifth intercostal space here as well. Okay, so now since I told you about that, what I'm going to do, I'm going to go back and listen to it with my bell and my stethoscope. I mean the bell and the diaphragm, and then I'm also going to listen for murmurs, which will be an additional heart sound to the sound. Okay. Now I'm going back with the bell. And I also want to make a correction too. The tricuspid valve is between the third and fourth intercostal space. That's what I want to tell you about. And now I'm going to go back up and I'm going to listen to as well. I'm going to listen to see if I have to check for bruits. That's what I'm going to do. What I want you to do is I want you to take a deep breath. Okay, let it out and hold it. Other side, let it out. Deep breath. Okay, hold it. Okay, no bruits, and I'm gonna check now for the pulse deficit, and that's where I will lightly palpate your carotid artery, and then I'll also be listening with my stethoscope to see if I can hear the pulse there as well, to make sure that there's no pulse deficit. Okay, there's no pulse deficit. Everything is actually the same. So now what I'm going to tell you is the S1 is the lub sound. The S2 is the dub sound. The S1 is louder at the apex. The S2 is louder at the base. Okay. The S1 is the closing of the tricuspid valve and tricuspid and mitral valve, and the S2 is the closing of the semilunar valves. Okay. S1 is systole, S2 is diastole. Now I'm gonna check all of your pulses, okay? Okay. And I'm gonna do that bilaterally with both sides. And the femoral, which will be in the groin area, and it will be between the pubis and the superior anterior iliac spine. But I won't palpate that. Okay.
Okay.
And I'll do the inner part. This is the posterior tibial. And then all of your pulses were equal bilaterally, and they were +2. Now I'm just assessing to see if you have any edema, and there's no edema that is noted in his lower extremities bilateral. Can I get you to hold up your fingers again? We're gonna check the clubbing of your hands. Give me the heart. Give me these two specifically. Okay. Okay. The clubbing. There's no clubbing. Everything is the index is less than 160 degrees. Just want to check your capillary refill. Less than 2 to 3 seconds, and the contour is convex, and the color is pink. And so that concludes the cardiovascular system checkoff. Mr. D, thank you for being such a good sport. I really appreciate you. And that is the end. Is there anything I can do to help you feel more comfortable? Okay, thank you.